open up the floor, I suppose, for anybody who has any questions for us.
Thank you, Elizabeth and Ray. I did find that it's really nice. We're all, as counsellors, like I said, you know, we're all corporate parents, and we rarely get a chance to see the young people that we are tasked with looking after. And you know, she was yeah, I'm just getting sure. Yeah, we can cut out that part of the meeting so that Lauren isn't exposed to the public eye. It's enough that we've seen her, and she's obviously happy. She's having plenty of opportunity to feed back. Thank you for the report. I'm really glad it's coming to Corporate Parenting Committee, because I found it extremely interesting to read, and I found it very honest as well. And you weren't trying to hide things under the carpet. Everything was exposed everything that needed to be said. It was very clear that it was being said, and that's really, really important, because if we're going to improve the future prospects of our young people, we've got to challenge ourselves at every point, really. So I'll open it out to the floor. And who we got first? Put the hand up. Councillor Patel, would you like to come in?
Yes, thanks. Let me just pop my camera on. Hang on. Right. Hi. I thank you for the presentation. And like Nicole said, it was a very honest report to read, and it was really interesting, really well set out. I did have a question around the, how did you phrase it in the report? The restatement is that how it's said in the report? Or, you know, the re-entry into the, after we've discharged and we've brought them back in? I just want to know if you could pick up a bit about that, because it was mentioned in the report and it is an area of concern. I don't think the report quite covers what that means in enough detail for me, and I'm sure other members will have questions around that as well. So are you able to just cover off what that process is, and why people, you know, we discharge into and then they come back in?
Yeah, I think, Liz, shall I come in here? Thank you, Councillor Patel. I think, and you tell me if I'm wrong, but I think the section of report is referring to children that have been registered on the Child Protection Register, deregistered, and then in a short period of time have come back in and gone back on the Child Protection Register. Am I clear that that's the?
Yeah, that's exactly it.
Okay, thank you. Yes, it's an area of concern. We are looking at that, and we do audit that, because, you know, it suggests obviously something didn't go as well as it could have done. The cases that we have looked at where that's happened, it appears that potentially it was premature for those children's names to be removed from the Child Protection Register. Now, there are situations where you know, those decisions are made, and they're made based on evidence, and at the time that evidence is correct, but then there's a significant change in the family. So I think an example that I've used in the report is around domestic violence. So what we found in certain cases is that there's a significant risk of domestic violence. That relationship ends. There's been a period of time where people are satisfied that relationship has ended, but actually, once professional scrutiny is removed, at a later date, those parents resume their relationship. There is another incident, and that starts that process again. And you know, that doesn't mean to say that we couldn't have done things differently. It's really about how we assess you know, real fundamental change, so people aren't resuming such damaging relationships. Yeah, so it's certainly an area for us. We do need to keep looking at that, because, you know, it's not in children's interests at all to bounce back and forth on the Child Protection Register. We did also find there were some cases where you know, really there was a bit of reliance on self-report from parents, and sort of maybe not enough scrutiny in terms of you know, not just believing what they were saying, but actually having a longer period of time of assessment to check that the things that they were saying were the case were actually the case. So yeah, it's definitely something we're live to. And I think perhaps it's not been something we've been live to historically, but it is now. So we're really looking at that and checking that the decision making at conference is safe decisions, so we don't get these cases back and forth. Liz, did you want to come in there?
Yes, please, if I can. Thank you, Ray.
Yes.
I just want to say then, thank you, Councillor, just to join the loop then as well, as when we've done some QA audit work on these cases, it's imperative that the learning and the findings are fed back then into our safeguarding teams and the IROs, so that they can understand what the findings are, exactly what Ray has just said, and we can look at, do we need to change some practice? Do we need these cases open longer? Are we confident that we're stepping them down into early help services as opposed to just out of the limelight, if you like, of children's services? So that scrutiny of that relationship and of the dynamics and of any incidents continues in the early help services, and of course they can be stepped back up then into safeguarding at any time that the risks are identified, that they need more statutory involvement from safeguarding. Thank you.
Laura, I noticed your hand's up. Did you want to come in on this?
Yes, yeah, I just wanted to add really that we did recognise, and I don't know if people will remember, but at year end 1920 we did recognise in CPA that at the end of the year our rates of re-registration were exceeding our target, so we were obviously concerned about that, but we sort of noted that and began that scrutiny of those cases. Our target was 5%, and we were up at 8.3 at the end of that year. So that's when Liz and Ray did that piece of work with colleagues in early help to look at those individual cases and what we thought had resulted in those re-registrations and how we could bring those numbers back down and prevent that becoming a theme, which I can just reassure you has happened. And our re-registration rates, I don't have the current rate at my fingertips, but I know that we were within the 5% target when we last looked at the figures as well. So we did do that work, and we have brought that down and are maintaining that level of performance now.
Thank you, Laura.
Is
that okay, Councillor Patel?
Yeah, really encouraging, and I'm glad to see that it's not silo. We are working amongst with early help and as a one council sort of approach, so it is really encouraging.
Are you happy to move the report, Councillor Patel?
Yes, I should move the report.
Lovely. Okay, next we have the leader, Councillor David.
Okay, thanks, Chair. And I'm happy to second the report, and I thank the team, because it is a very small team, for the work that they're doing. I wanted to ask about younger children in particular, and how we're able to engage with them to hear their voice, and what impact COVID has had, good or bad, in engaging with children of all ages, and whether there's an opportunity, particularly with our younger children, our primary school and infant age children, whether there's more opportunities within a school setting to hear their voice in a much less formal environment. I'm sure that there are steps that have been taken, but I'd be very keen to hear about what we can do to make sure that those younger children. I understand. You may correct me on this, but a lot of older children, teenagers in particular, quite often don't want to engage. So even if they have the capacity to engage more effectively, they quite often, certainly when I was more involved, that was not something many of them were keen on doing. But with young children, it can be more about how that engagement takes place. And then secondly, building on Councillor Patel's question, you've identified clearly in the report that sadly domestic abuse is still a common factor, that possibly I think it was the most common sort of factor in cases where children have been deregistered and then are re-registered because the the parent returns to a relationship where there is domestic abuse. So I wanted to ask about our schemes that we do have in place that work with perpetrators of domestic abuse and with fathers in particular. And that's just me recognising. I'm not saying that all domestic abuse is undertaken by males. It's just a recognition that the most common form of domestic abuse is by men and fathers in the home environment. And I know we've got that perpetrator program, but I don't know if that was paused because of COVID, and if there's any more work we need to do with families where domestic abuse is a problem, and clearly it is a contributory it is a contributory problem, then, is what we're saying, to children requiring additional support. Is that risk that domestic abuse presents to the family and the children? So 2 questions there. Thanks, Chair.
Okay, thank you. Liz, are you happy for me to come in here? Yep, thank you, Councillor David. If I can just respond initially to your first question in relation to consultation. I think to touch on the differences that COVID has made, we've definitely seen a difference with older children and their happiness to be consulted because of using virtual platforms, and we understand, I think, the reasons why. But for younger children, of course, they're not as computer savvy and don't have access to that. So that's definitely an area that COVID has caused some challenges, where, of course, pre-COVID, the independent reviewing officer would go and visit these children in their placement, and even actually would more often than not visit babies, even children that can't give their voice. The RO would go and make professional observations of their placement. So so we don't just consult with children that are able to verbalise. But we do, our consultation documents that we have, they are age appropriate, and they're interactive, and the use of emojis and smiley faces and things like that. We do encourage schools to undertake those consultation documents with children. So we get a lot of our return rate is via teachers, where they've sat down and undertaken a session with that child, and we're really grateful when we get that, and for schools to do that for us. And interestingly, also, there's the personal education plans for children that has a section of a wider consultation, so not just in relation to school, and the teachers will undertake that as well, and that gives really great feedback for children. Of course, they're age appropriate. So there are mechanisms, even though the ROs are not able to visit children currently, but we do recognise it is more challenging with those younger children because we can't utilise the virtual platforms like we can the older children. And certainly my team is really looking forward to getting back out there and visiting children in schools or in their placement, or in Starbucks, or wherever that child wants to meet. So we do recognise it is definitely more of a challenge for the younger children, but there are some mechanisms in place there. Does that answer that?
Yeah, and I just wonder whether there's some, given the importance, because it is a statutory function, isn't it?
Yes.
Independent reviewing officer role, and it is about safeguarding children. I just wonder whether or not we need to have a think about whether or not those visits are restarted. I understand the balance, but and I wonder whether the opportunity, if a lot of those children would be in a school environment where we minimise, some additional sort of activity by undertaking that in the school environment. So it's just a thought, because I'd like to think that it'll all be over by the summer, but but it isn't, is it? It's not going to be all over by the summer, unfortunately. So we're going to have to learn to deliver some of these crucial services in a different way, and weigh up the balance of risk. So I appreciate that social workers, their safeguarding social workers will be undertaking those visits as well. So I'm not suggesting that those children aren't safe, but it's that wider welfare role that you're undertaking, and indeed a level of safeguarding, isn't it? Because it's making sure that it's belt and braces, isn't it, for our children. So thank you for that.
Do you want to come in on that, Elizabeth? Oh, you're on mute.
Sorry, thank you. I just wanted to say as well that we don't forget about advocacy service and about Trosgynnol. And you know, that's a regional service for us, and my understanding is that we're the highest referrer to that service. So, you know, a different person, a different feel, but another opportunity for a child to have his voice heard. And of course, you know, with every opportunity when we work in a multi-agency way, we will take information and feedback from every professional about the well-being of the child. So it isn't just kind of in a certain environment. We would want to make sure that the child's well-being is reflected, you know, across all the activities, where they live, where they learn, who they play with, you know, who they interact with. And I understand that's a bit more challenging at this minute, but where we can glean information about their health and well-being, we will do so. Thank you.
Thank you, Elizabeth. Is that okay, Councillor David? Yeah, lovely. Okay, next up we have Councillor Cheryl Green, please.
Oh, sorry, do you mind if, sorry, Chair, can I just interrupt? Sorry, I don't think I didn't answer the second point of Councillor David in relation to domestic violence. Sorry, shall I just do that? And then
finish off.
Okay, thank you. So in terms of programmes that we have that we can refer into to address domestic violence, we have a number of programmes. We have the Drive programme, Inspiring Families, and through probation, the Choices programme. I think there's been much more greater recognition more recently about a lot of these relationships will continue, and you know, in certain cases there is a role to work with both victim and perpetrator and looking at keeping children safe. And I think historically it's been much more, there's been much more focus on, you know, the relationship must end and work is done with the victim. But times are changing. So the Inspiring Families programme is something that we use a lot. I don't have the referral figures to hand, I'm afraid, but you know, I do see very regularly involvement from that service and positive feedback in terms of that. There has been that has been interrupted by COVID, as have all services. But things are up and running now. You know, I think initially there was you know, some delays and difficulties while people and agencies worked out how they were going to deliver virtually, but that is now happening. So yeah, so that is pleasing to hear. So we do have tools and services that we can utilise to address domestic violence, and you're right, Councillor David, domestic violence is you know, a huge area of work, and it's something that's very sadly we see on so many of our cases. And interestingly, just a point, we also do utilise programmes for children who've witnessed and been exposed to domestic violence to break that cycle, and help them to understand some of the things that they've witnessed and who to go to if that were to happen again. So it's a sort of two-pronged you know, approach, work with parents, but also the child, and developing safety plans around that child. So God forbid, if there's further incidences or exposure, they know what to do to keep themselves safe and to speak up.
Okay, Liz, do you want to come in? Oh, you're on mute again.
Sorry. I just think it's important to mention that Councillor David talked about engagement with younger children, but I just wanted to touch on, I think we do have some work to do with regards to consultation and participation with older children or young people, and there was a lot of work, a lot of focus on that area from the 16 plus team, looking to bring young people together so that they can seek support from one another with regards to having their voice heard and sharing that. So I know the team had worked very hard, looked at a questionnaire, an easy read document that young people could relate to, but we had a very limited response from young people when you think about the number of young people that we look after and our care leaver population. We held 2 consultation events, and this was back in July 2019. Again, limited about how many young people took up that opportunity. So they looked at, where could they meet, how could they meet, try and make it as relaxed and as friendly as possible, rather than it be a formal, you were all children who were cared for, just try and bring them together and unite them as a group of young people. Looked at developing a newsletter, and then COVID hit us. So, that's a piece of work that was moving along slowly. But still needs a lot of focus, and something I know the teams will pick up on the IRO service will assist in that as things start to change again. So I just didn't want to lose that group and how we were going to communicate and hear them. Thank you.
Thank you for that. I apologise for that, Councillor Green. I jumped the gun there, but do you want to come in now with your question, please?
No problem, Chair. Thank you very much. Very quick question from me, probably for the Director. In Appendix A, page 80 on the actual agenda, page 18 on the appendix, there's a reference to reduction in clerks for the child protection team. I would just like to ask, will this pressure be addressed under the current budget proposals, please?
Should I come in, Chair, on that one? Okay. Yeah, so in terms of the workforce, we keep it under constant review within the resources that we have, based on our ability to meet need. So in terms of the IRO service and indeed all of the teams that Liz is responsible for, we look at our business support, and we use our business support across the directorate flexibly. There is a single business support manager who looks at moving around that resource to meet the needs within the different services, and we will continue to keep that under review as pressures arise and as needs change. And certainly we won't be looking to reduce our investment in our workforce, and as opportunities arise and as needs arise, we may look at shifting resource from elsewhere. So absolutely will be kept under review.
Laura, did you want to come in?
I suppose I wanted to sort of expand on that slightly as well, to say that we, I think there was a concern that was one of the risks when that sort of that team in business support was when some realignment took place and things were changed. But that's why there is a minimum of at least quarterly meetings between Ray as the operational manager and Liz as the group manager with colleagues in business support to monitor the impact of that. And if there are any issues emerging in the meantime, we would always sort of get together and discuss those and look at how they could be addressed, including manoeuvring resources if we need to as well. So I just wanted to reassure you that is under sort of constant review, really. I also would like to, I suppose, add to Liz's comment at the beginning of the presentation about caseloads as well, because I was anticipating a question, so I'm preempting that really rather than waiting. And again, I just wanted to say that it is something we're mindful of and has been something that's been under regular review for a number of years now. So I think we first recognised in Bridgend formally in 2018 that our caseloads for IROs were higher than some other neighbouring authorities and other authorities in Wales. And all of the IROs at that time had caseloads of over 100, and the highest at that time was 116. So we did do a piece of work in June 2018. We did review the caseloads, and at that point we changed their working arrangements. We reduced the number of pathway plan reviews that they independently chaired. Those were transferred to the 16 plus team, which is an approach a lot of authorities in Wales take, and we did bolster capacity within the team as well, so that caseloads at that point, the annual report 18-19 said that caseloads were between 88 to 100, which were deemed to be an acceptable level. and we weren't a huge outlier. We weren't such a huge outlier compared to other authorities in Wales then. So we do, as Liz has indicated, I think we've remained fairly steady now, which is reassuring. So, you know, we're at an average of 95, as Liz has pointed out, but we will continue to monitor that. But I think as well to bear in mind, we are reducing our population of children that we look after in Bridgend. We're also constantly reviewing the numbers of children on the Child Protection Register as well, and haven't achieved as many deregistrations because of the pandemic over the last year. But work is ongoing to reduce numbers of children on the Child Protection Register as well. So that will also positively impact on those caseloads. So I just wanted to say that that is something, it's an improving picture, and we're continuing to go in that direction. But the other thing as well is that if caseloads, you know, if we do have absences within the service, or if caseloads become too high, we do occasionally as well use sessional IROs and conference chairs as well, who can come and work with us on individual cases, or carry small caseloads for us for a time limited period as well. And I know we're doing that at the present time as well. So just to say, those are some of the ways that we manage those challenges really and pressures in the service.
Thank you, Laura. Is that okay?
Yes, thank you very much, Chair. Thank you, Laura. Thank you, Claire. That was very well explained. Thank you.
Thank you. I was going to make that point myself, so I won't now. But I did have one question, and it was regards. Well, it was quite disturbing, really, that the most common factor is neglect. And I was just wondering, do we have statistics as to how many children who are identified as suffering from neglect, how many are eligible for free school meals, and how important are our free school meal provisions for children who are in that situation?
Thank you. I don't have any figures to hand in relation to free school meals. Anecdotally, I would imagine that a very high proportion of those children would be eligible, but that is just anecdotal. But it's definitely an interesting, point, and potentially something that we, could look at. But my, as I said, I think a high proportion would be.
Okay, thank you. Laura, did you want to come in on that?
I was just going to say, I'm volunteering colleagues now as well as ourselves in the Education and Family Support Directorate, but I'm sure we could, we could cross-reference our data, and I'm sure we could get that information for the committee if they wanted that. I'm happy for that to go down as an action for myself and Nicola to follow up and provide you with information on.
Thank you. I would really appreciate that, because we have a report to Cabinet on the free school meal provision, and I think that would be some interesting evidence for us to consider on that. Thank you. Okay, are there any more questions from other members of the committee on this report? No, it's been moved and seconded. So we note the report. Thank you so much, Liz and Ray, for presenting that to us. I found it really interesting, and yeah, I am just fearful of what's going to come this time next year as we pick up the pieces, and it's not so easy to keep an eye on our families, and domestic violence is a concern, as is neglect, and families aren't so visible at the moment, are they? So I just hope we can pick up those children in need as soon as possible, really. So thank you so much. So I have no urgent items, so I declare the meeting over. Thank you very much, everybody.